In this video, we will talk about a complication of IVF, treatments done for fertilization. This complication is Ovarian Hyperstimulation Syndrome, OHSS. What is Ovarian Hyperstimulation Syndrome? Ovarian Hyperstimulation Syndrome is a condition that can occur in women undergoing fertility treatments, IVF, particularly with injectable hormone medications that stimulate egg development in the ovaries. Prevalence: it affects 1 to 3% of women undergoing in vitro fertilization or other fertility treatments. Pathophysiology: following factors can contribute to ovarian hyperstimulation syndrome. Hormonal stimulation. Ovarian hyperstimulation syndrome is primarily caused by the excessive response of the ovaries to gonadotropins, leading to enlarged ovaries and increased vascular permeability. Fluid shift. Increased capillary permeability results in fluid shifting from the vascular space into the abdominal and thoracic cavities, leading to ascites, and in severe cases, pleural effusion. Risk factors. Following can lead to ovarian hyperstimulation syndrome. High estradiol levels. High levels of estradiol during fertility treatment. Polycystic ovary syndrome. Women with PCOS are at higher risk. Age: younger women, particularly those under 30. History of ovarian hyperstimulation syndrome. Previous episodes of ovarian hyperstimulation syndrome increase the risk in future cycles. High number of follicles. Greater number of follicles stimulated during treatment. Classification of ovarian hyperstimulation syndrome. It is classified into 3 categories: mild, moderate, severe. Number 1. Mild ovarian hyperstimulation syndrome. Symptoms: patient can have mild abdominal bloating, mild pain, and nausea. Management: it usually resolves on its own with conservative measures. Number 2. Moderate ovarian hyperstimulation syndrome. Symptoms: patient can have moderate abdominal pain, nausea, vomiting, and diarrhea. Ovarian enlargement could be from 5 to 12 centimeters. Management: close monitoring, increased fluid intake, and rest. Number 3. Severe ovarian hyperstimulation syndrome. Symptoms: patient can have severe abdominal pain, rapid weight gain, significant abdominal distension, dyspnea, and reduced urine output. Ovarian enlargement can be more than 12 centimeters. Management: hospitalization, intravenous fluids, and careful monitoring of electrolytes and organ function. Diagnosis of ovarian hyperstimulation syndrome. It involves 3 steps. Step 1. Clinical examination, evaluation of symptoms and physical examination findings. Step 2. Ultrasound, imaging to assess ovarian size and the presence of ascites. Step 3. Laboratory tests, monitoring hematocrit, white blood cell count, electrolytes, liver and kidney function tests. Prevention of ovarian hyperstimulation syndrome. It can be prevented by individualized protocols, tailoring the stimulation protocol based on patient risk factors, lower doses of gonadotropins, using the lowest effective dose of hormonal medications, coasting, withholding gonadotropins for a few days to allow estradiol levels to decrease, triggering with GnRH agonist instead of HCG to reduce the risk of ovarian hyperstimulation syndrome. Freeze-all strategy, freezing all embryos, and delaying embryo transfer to a later cycle. Conclusion: from the above discussion, we can conclude that awareness and monitoring, early recognition and close monitoring are key to managing ovarian hyperstimulation syndrome effectively. Tailored treatment, personalized treatment protocols, can help minimize the risk of ovarian hyperstimulation syndrome in women undergoing fertility treatments.